Hello, my name's Becca and I'm going to be telling you guys about migraine severity today. I wanted to start off by asking if anybody has had a true migraine before, because it can be a little bit hard to differentiate between headache and migraine, especially if somebody's never had a migraine before. It's kind of hard to understand what that feels like. A fun fact about me is that I had a stroke in December of 2019. That was the worst migraine I've ever had. For those of you who don't know, I'm sure you all do, but it's caused by a blood clot in the brain, so it was very painful. It just felt like a sharp pain in the left side of my head. That being said, I've been to the doctor many times for treatments for migraines. I've had chronic migraines for years, so I've gotten a lot of medical professional help on that. And I've tried many different treatments, and I've kind of figured out which one best works for me. There are many different types of migraines, and that can make treatment a little bit more difficult. The first type of migraine I'm going to be talking about is a sinus migraine. That is caused by congestion in the sinuses, so that would be under your eyes and kind of in your nose a little bit. And that just causes kind of a feeling of pressure in the head. So sinus migraines just really feel like pressure. And then there's a tension migraine, and that is usually caused by any kind of, if you sleep wrong on your neck, that can cause it, or if you're stressed, that can cause it. If you hurt your neck somehow, that can cause it. It starts at the base of the skull, kind of at the top of the neck, and then it works its way up to kind of the crown of your head, and it's like kind of a sharp pain. And then there's a migraine with aura. An aura is a kind of a sign that you're going to have a migraine soon. For me, it is, I see kind of fluttery dots in my peripheral vision, and it can be caused by excess movement, it can be caused by stress, it can be caused by sinus congestion, any of that. So it's just kind of a sign. It can be a little bit scary, so it is important to know that that could just be a sign of a migraine, because you don't want to freak out if it's just a migraine. And then there are different treatment types based on each of these migraines. So the first one I'm going to talk about is an allergy medication. So that's usually used for sinus migraines, but it can be used for other types of migraines. I'm not necessarily sure how that works, so I'm not going to speak much about that. But any type of medication that kind of decongests you in the sinuses, then that is used for sinus migraines. And then there is preventative medication that is used for people with chronic migraines. So that is, you've had a migraine disorder over a certain period of time, and you have them, I think it's once or twice a month would be considered chronic, and you have to have it for, like I said, a certain period of time. So this can be any type of medication that's taken every day, or some people get a shot. The shot, you can get it once a month, you can get it once every 3 months, or once every 6 months. It just depends on what type of medication your doctor wants to put you on. And that's usually used for tension migraines, because people with stress, it's usually consistent with their migraines, so they would need that. And then there are painkillers that are usually taken at the onset of a migraine, so that would be right, obviously, when it starts, and then it kind of lessens the severity of the migraine, or hopefully gets rid of it completely if you take it at the right time. This is usually used for people with migraines with aura, which is why it's important to note that even though the aura is not technically its specific subtype of migraine, there are different treatments for migraines with aura. So it is important to note that as well. And then the different types of migraines, like I said, make treatment a little bit more difficult, so it's important to know each type and what type of treatment can work best. There are some specific treatments that work better for some people rather than others, and it really depends on how the person reacts, and it's important to know which works best for you individually, and it does take quite a bit of time to figure that out. Thank you.